Good afternoon and welcome to this press conference with the Minister of Health, the Minister of Defense, the Minister of Home Affairs and the Minister for Transport and Urban Mobility. Mr. Illa has the floor. Good afternoon. We appear before you together with Mr. González, Superintendent and Deputy Director of the National Police Forces, Mr. Ceña, Lieutenant General and Deputy Director of the Civil Guards, Mr. Villarroya, Chief of the Defense Staff and Lieutenant General, Mr. Simón, Director of the Center for Coordination of Health Alerts and Emergencies, and Ms. Rayo, Secretary General for Transport and also official of the Civil Engineering High Body. We are the delegated competent authorities to deal with the coronavirus crisis under the direction of the Prime Minister. We held a meeting this morning with him and we wanted to report on the content of the decisions that we made. First of all, I would like to remind you that our country is facing at the moment extraordinary circumstances which required us to adopt exceptional measures in terms of public health. It is in difficult moments when we bring out the best of us, solidarity and responsibility. First of all, let me, on behalf of the government, acknowledge and thank the civism and examples by Spanish society. In the face of the declaration of the state of alarm, I would like to thank the way in which citizens have internalized the need to comply with the recommendations and the measures to stop the spread of the virus. Citizens in our country have understood that this is a battle that we have to fight together, and it will be together that we win it. With their example, they are reminding us hour by hour that we are a great country, that we can stand together and that we will not surrender. In the same way, we would like to thank citizens for the gesture from last night towards healthcare professionals in this country, which are the professionals at the front line in stopping the virus. I would like to tell them from the government that we join this spontaneous homage that fills the balconies in our cities and towns in support of healthcare professionals. Over the weeks we had the chance to see the effort that they're making in order to treat people who are infected and to stop the spread of the virus. We know they're working relentlessly and they are making a huge effort. They are giving us a lesson of heroism. We would like to recognize the huge work carried out by autonomous communities, in particular the regional health ministers and their teams. I will give you the details of the first decisions that we've made after the meeting with the PM. Please allow me to refer to the ones related to health. We have 3 orders that will be published in the next few hours. First of all, we have a set of measures to strengthen the health system. First of all, we will make regional ministers of health to be in charge of all health facilities so they can use them as they deem appropriate to meet the needs that we have. Also, the health authorities in each autonomous communities, that is the regional ministers, will be able to use public space or private space with the necessary conditions to provide medical assistance to those in need, whether it's consultations or hospitalizations. We've also decided to extend the recruitment of medical internal residents of geriatrics, work-related medicine, family medicine, intensive medicine, internal medicine, preventive medicine, pneumology, pediatrics, radiodiagnosis, microbiology, work-related nursing, community nursing, geriatric nursing, and pediatrics nursing, among others. We suspend the ongoing turnover of residents so that they can provide services in the places where they are needed the most. We exceptionally authorize the recruitment of people with a degree in health studies who still have no specialist degree to provide services. Only in the following cases. In those cases where they've passed the tests for resident with no place, and also if they've obtained the degree outside the European Union, but they're still awaiting recognition of the degree. There is a second set of measures in terms of health aimed at supplying the goods and services necessary to protect public health. Since the publication of the order in the official gazette, we are giving 48 hours to those people who have a stock of specific sanitary products, have the obligation within 48 hours to inform the Ministry of Health. We refer to surgical masks, diagnostic kits for COVID-19, quick diagnostic kits, isotopes, glasses, gloves, disposable and waterproof gowns, hydroalcoholic solutions, and invasive mechanical ventilation devices. Any natural or legal person who has this type of material, they have 48 hours to report to the Ministry of Health. At the same time, it's mandatory for those companies who have the production capacity to produce this type of materials, make it known to the Ministry within 48 hours. Non-compliance with these measures will lead to penalties. Thirdly, we've issued an order for a set of measures aimed at ensuring the provision of information and data by autonomous communities. We will make an update, we will give an update on the disease every day in the morning after the follow-up meeting of the committee, and therefore autonomous communities have a deadline and criteria to provide any information which shall be given in the morning, and then we will provide instructions so that they send us their contingency plans, so that we have as a whole measures that are fair and cohesive in the treatment that we provide. These are the three first orders in terms of health. I will give the floor to the Minister of Defense. She's the competent authority. Good afternoon. First of all, I would like to join my colleague in his reflections. I think that we have to be aware that Spain as a whole country is going through a pandemic. It's a difficult moment. That's why the government issued the state of alarm. We understood that it was absolutely necessary, it was essential, and the decree comes together with a call for responsibility to all citizens. Spain is a serious country, its citizens are serious, and we are all aware that we have to safeguard not only our health but also the health of others. That's why we have to be generous and not only think about our personal situation. We need to avoid the spread of the virus. That's why, taking into account that we have to be responsible, the decree was issued. And as I was saying, this is closely linked to the requirement to each and every one of us to comply with the rules. These rules don't understand of ideologies or communities, they only understand of our priority, which is the right to health and the health of each and every one of us. The armed forces, as they usually do, and as set out in our constitution, have a clear function: safeguard the rights and the security of all citizens. And the law also provides for situations like this, situations of an emergency. And the role of the armed forces is very important to ensure that safety and the right to health, but also to help each and every one of us who might need it in order to deal with this dramatic situation. That's why today we held a meeting with representatives from all armed forces to make measures in the operational field and also in the health field. In terms of military health, we've made available all the means, including the military hospital in Zaragoza. They are made available to the Minister of Health, and we've also called those doctors that were in reserve, as we say, to collaborate and to work together with us, because we have great professionals in the armed forces, and obviously they are completely committed in collaborating to face this difficult situation. At the same time, we've asked the military pharmacy to provide anything that is necessary, whether it's disinfectant or any medicine that is missing, so that they can provide it. Obviously, anything to do with beds, whether it's in hospital, and those beds that might be needed in several hospitals or specific places, will be made available from military health. Also, in terms of operations, we've set up a unique commander that will be led by the Chief of the Defense Staff, Mr. Villarroya, aimed at unifying all efforts in different fields. The Minister of Defense and the Armed Forces have made available to the government and to the citizens all the capacities that we have, whether it's staff or transport or logistics, and obviously anything to do with airspace or sea navigation. We thought it was very important that citizens see armed forces as they are. It's a part of society, it's integrated, and it wants to help in difficult times. That's why today we took the first measure, which is that the emergency military unit, which is the UME, which is very close to citizens, has been deployed in 7 cities where they have bases. Some may wonder why only in these cities, but this is because we've chosen cities where we have bases, so that they carry out scouting tours to monitor those areas where the risk of infection and contagion is higher. From tomorrow, the presence of the UME will be intensified in other cities, and today we held a meeting with the single commander and also with the Minister of Home Affairs, a meeting for actions that might be needed from transport point of view, for example, transporting people, supplies, or surveillance services. And I do hope that we are all responsible and we don't have to do surveillance, but if necessary we will take action as well, because we think it's important that there is the presence for those people who are not so responsible. Maybe the armed forces will work together in cooperation and collaboration with the police forces, with the civil guards, in all missions that we understand as necessary at any given time. If we have to evacuate people who are in a difficult position, then as usual the air forces is 24/7 available, so we will carry out those evacuations. We also have the sea forces, and we have to take decisions in different places. We held a meeting with them, and all means, and that means all men and women of armed forces, are generous and they are willing to help. And together with the Ministry of Social Affairs, we will take measures to help those people who are homeless and who have no resources. So we will try and provide them with food resources. Therefore, we call for responsibility. We need to do it. Coronavirus doesn't understand of borders or countries. This is a threat to all people, to our health, and we will have to be thinking of others, not only of our own situation. And you have to know that the armed forces are always willing to do whatever necessary to comply with the measures. This is provided for in the Constitution, and we want to ensure the rights of citizens, in this specific case, the right to health. Any other activity, transport activity or logistics that is necessary, we will be available. Both the emergency unit and the 3 armed forces, we are fully available. We will make every effort in all places in this country, because there are no borders. Whenever and whatever necessary, where there is health needs, when we have to protect citizens, as we always do, we will be there. Thank you very much, the Minister of Home Affairs. Good evening. I would also like to start by acknowledging and thanking the work and professionalism of healthcare professionals. They are at the forefront in the fight against this virus. Obviously, they are an example and a guiding star. As a consequence of the decree issued by the government yesterday establishing the state of alarm, last night, among other measures, I issued an order detailing the criteria for action for police and security forces aimed at dealing with this situation. The priority goal of these measures and the mission the officers have is to help citizens. Our goal is to protect the health and safety of citizens and obviously to contain the coronavirus. I hereby ask all Spanish citizens to comply with the requirements and measures of the police forces. To officers from the National Police, the Civil Guard, the Mossos d'Esquadra, the Chancha, the police forces of Navarra and the local police forces have been tasked with this mission. From here, I would like to thank them for their commitment. The order sets out the common criteria for all police forces. As I was saying, they will have to act in a coordinated manner under the instructions of the Ministry of Home Affairs to make citizens comply with all the measures, to help with health actions, to ensure the supply of foodstuffs and to ensure the functioning of essential and critical infrastructures. Unity of action at this point is essential. The goal is to coordinate something necessary so that we can face together this situation, obviously to contain the virus. Only by doing so, and the PM said it yesterday, only united we will be able to fight the virus. Coordination has proven to be the most efficient tool, and we will show this once again. We've held a meeting in the Ministry of Home Affairs, as the Minister of Defense was saying, the first meeting of the Coordination Center to work together All the decisions are aimed at helping as possible the fantastic job that healthcare professionals are carrying out. They are at the front line, and we have one of the best health systems in the world. Let's not forget it. We have the best professionals, and they are working tirelessly. So we have the duty and responsibility to help them in their jobs. We have to comply with the measures. And the work of the Ministry of Home Affairs and all police and security forces is also aimed at protecting those who are most vulnerable, especially elderly people who might be affected by this situation. Therefore, we will strengthen all the citizen security plans, such as the elderly safety plan, which is aimed at improving the safety and security of our elders. At the same time, we're adopting other measures to protect the health and help citizens to comply with the royal decree that was approved yesterday. As you may know, this royal decree also sets out that all intervention and emergency services for civil protection will also act under the Ministry of Home Affairs. Today, in those measures, I have signed another order that's aimed at the criteria that will be adopted in the National Civil Protection Service to address this situation. Tomorrow, Monday, we will hold the first meeting of the State Committee for Coordination for Civil Protection, which is also under my presidency and which will have representatives from all communities. We have to stress the coordination between the central government and the local and regional administrations. As I was saying, this is essential. We have to be the most effective we can be. I've also issued another decision for prison institutions. This is a very sensitive area given the circumstances, because we talk about people who are already prisoners. We've suspended ordinary communication and permits, but we've extended telephone communications of prisoners so that we can compensate for those limitations. I would like to thank the professionalism of prison officers who are living very difficult times, and they have shown a great sensitivity. They have collaborated and cooperated with prisoners as well. All measures that are being adopted are aimed at protecting the health of prisoners, but also of prison workers. As I was saying before, and that's why I'm thanking their work and their cooperation, we don't have significant incidents to report in prisons. We all understand that the main goal is to protect the health of everyone. I inform you that today, in this first of application, we are not seeing any significant incidents, which shows the civism and responsibility of citizens. Spanish citizens are always, as usual, rising up to the challenge, and we are complying with the measures as soon as they came into force. From the government, we can only thank citizens for their behavior, which the PM also acknowledged yesterday. I have some data here demonstrating, proving this behavior. We have data from the traffic agency. They've seen a dramatic reduction in the movements on road. Today, 2 hours ago, there was a reduction of 61% of movement to access the city of Madrid when compared to last week. This is very significant, and this is seen as solidarity. I insist the police and security forces and all departments of the ministry and the regional ministers of the autonomous communities are complying with the task of helping citizens, which is what we should be doing, and we're trying to contain the virus. Once again, I would like to thank citizens for their commitment, for their sense of responsibility. As the Prime Minister said, this is a battle that we are going to win. Let's be undoubtful about it. We will go forward, and united we will defeat the virus. Thank you very much, Minister for Transport. Good evening. This health alert makes us very careful when ordering transport in the fight against coronavirus. We have to work together. Citizens must assume their responsibilities and only travel when they really need to, in accordance with the royal decree of the state of alarm, and they have to be aware that the seriousness of this situation requires sacrifices. The local and public administrations, the autonomous communities, the city councils, will work in a coordinated manner for the benefit of everyone. Mobility is conditioned by reducing the risk of contagion and spread, and it has to ensure essential mobility to access public services and for the supply of basic goods and fuel, as well as access to workplaces. Avoiding the contagion and ensuring basic mobility have to be compatible, but will require the effort and understanding of everyone. We have to reduce drastically the mobility, and this will result in sacrifices. But we need to do it to stop this virus from spreading. I am the responsible for coordinating this, and pursuant to the royal decree that was approved yesterday by the Council of Ministers, I have decreed some measures. In public transport, road, railway, sea and air, the offer will be reduced by 50%, with the exception of commuter trains, where there will be more services in order to provide for basic services. We have ordinary services at the moment, but depending on the demand we will adjust the offer, and we will always ensure the overcrowding to avoid overcrowding of the transport. In terms of road, railway, maritime and air travel in autonomous communities, we have decreed that the autonomous communities might do as they deem appropriate, depending on the needs in their territories and depending on the progress of the health situation, always ensuring that they can access their workplaces when necessary. Local authorities will have to inform the autonomous communities head, that in turn will inform the central government in terms of hygiene measures in order to avoid contagion. The workers will have to clean daily the vehicles following the guidelines of the ministry. This is aimed at making people aware of the seriousness of the situation. The online selling systems will have to provide a visible message where they discourage people from traveling unless strictly necessary. Also, those services with tickets that provide a seat or a room will have to be monitored by the workers, who will have to distribute the passengers. Renfe will reduce by a third their capacity to ensure that there is distance between passengers inside the trains. Therefore, because of the spaces and the 50% reduction of services, it means that we will have a reduction of 85% of spaces in public transport. Tomorrow we will issue some orders in terms of the mobility between and within the Balearic Islands and the Canary Islands. Their development and application will be carried out by Maria Jose Rayo, who's here with me today. Finally, I would like to thank all transport operators, public transport but also private transport. I would like to thank the drivers as well, who are ensuring the supply of essential things so that we can carry out our jobs and that we can carry on with our lives. I would like to thank you for your sacrifice, for your professionalism, and for your commitment. Thank you very much. We will now move on to the Q&A. We've received the questions via chat. Thank you, ministers. As I've said, the questions are being received through a chat. First question by Sandra Gallardo from the National Radio Service. Why is the president of the Catalonian government not agreeing with the report? Are you afraid that Catalonia will act on its own? And how will you ensure unity of action? It's a general question. At this moment, the government is sure that everyone will act with unity, because we have a common goal, which is defeating the virus. So we have to act in unison, following the criteria. We think this is the way to do it, and we're convinced that everyone will understand this message and follow the criteria. Next question. Fernando Valls from La Información. For the Minister of Defense, will you deploy more troops on the streets if the situation gets worse? Will you extend the deployment to all cities? And to the Minister of Health, what economic resources will be used for these measures? Of course, we will deploy troops where necessary and in all cities, I insist, wherever necessary. We've started with 7 cities where we had the bases from the emergency unit. At 5 p.m. there was a meeting, and they are ready to deploy in those cities where it's needed, and obviously in coordination with the Ministry of Home Affairs. The armed forces and the UME will be deployed where necessary and essential. We've done it just in 7 cities because of operational reasons, but obviously we are planning, and we include many aspects from a transport or logistics point of view. In terms of security, we have the means, we have the willingness and the dedication of the armed forces, so that when it's necessary we proceed to deploy the army in compliance with the duty of insurance, the right to health of all citizens. That's why I don't see why other autonomous communities have political or not political interests at the heart of their priority. We have to look after the health of all citizens, and the armed forces, as they always do, will be there. We deploy troops to help citizenship. In the extraordinary Council of Ministers meeting, we adopted a series of measures that the PM informed about. We talked about the liquidity of accounts in different communities. We are dedicating some of resources to face these first measures. I would like to add, as the PM was saying, we will do whatever necessary, whenever necessary, in order to fight against this virus together. Next question, Agencia F, Enrique Rodríguez de la Rubia. Why is the percentage between positives in coronavirus and deceased in Spain higher than in other countries? Experts are saying that the rate is in line with other countries, and it's true that in some places in Spain we've had cases that have affected care homes, and this might explain the data. Question from the Canary Islands television. What are the criteria for deployment of the UME, and why both capitals in the Canary Islands? As I've said, we've deployed them in the cities where there were bases, 7 cities, and 2 of them are the Canary Islands capitals. I insist, this has been today, it's been the first day, we thought it was essential, but from tomorrow the cities will have the presence of the emergency unit. From Radio Libertad Digital to the Minister of Defense, the fact that Torra is not collaborating makes the government to fear for non-compliance, and how can we make him comply with it? I insist, if there is a person that is in charge of public office, I say with respect and great concern that they shouldn't be called person in charge of public office. This is something that is happening everywhere, and we're talking about the health of citizens, and this is the only criteria that has to be present at this time when we make decisions. I don't understand this. I know Catalonia, I know the people from Catalonia, and I don't understand why Mr. Torra doesn't really care about the health of his citizens, and I hope I'm mistaken. The political persons are responsible for their citizens. I insist, this is not a political issue. This is a very important issue. It's an issue of public health, and we have to leave politics aside. I don't understand his position, and if this is happening, he should be left out of public life. And when he makes reference to the armed forces who are committed to all citizens in Spain, well, they will act in all places where we understand that their action is necessary to avoid a dramatic situation, a situation like the one we're facing. The New York Times, for the Minister of the Home Affairs. Are you planning to remove the Mordaza law? Well, any law for citizen security provides for sanction and penalties in the field of public order. I don't think it's the moment now to derogate the law. I've said that this will be derogated and repealed. We will pass a law that is consensual in the field of the defense of liberties and freedoms, and we defend the activity of the public order forces. In our framework, the forces have to act with proportionality, and they have to enforce the royal decree to ensure the health of citizens and contain the virus. Daniel Baisteiro from InfoLibre. Several questions. Are you carrying out tests on everyone needing them? maybe there's not enough noticing due to the overcrowding of healthcare services. Why are you not envisaging a total closure of industry, agriculture and other sectors that are not essential? If there are no borders, why is there not European coordinated action? Well, we are doing tests on everyone who needs them. It's true that in some areas and regions in this country we've had to improve the logistics of the testing. We are working on it. We will design and put in place something that will be more agile. In Spain we've carried out more than 30,000 tests. It's a great effort. We have to change the procedure and the method. Therefore, we are working on designing this new procedure that it's available to people who, according to protocol, has to undergo this test. Well, we've acted following recommendations and also following European recommendations. We follow the HCDC, who recommended a set of measures. All European countries have been adopting these measures. Last Thursday we did it, and this answers the next question. Yeah, it doesn't know of borders, and we are working in a coordinated manner with the European Union. We've attended 2 Council of Ministers meetings, and there will be another expert tomorrow. There is a great coordination within Europe and also within the country. In terms of closing borders, well, this is a question for the Minister of Transport. Well, in fact, this should be the Minister of Home Affairs. Well, in this regard, coordination is important. The Prime Minister today has contacted several Prime Ministers from European countries. As we've been saying, the coordination is essential to fight this virus. Unity is essential, and as the Minister of Health has said, we will hold a meeting via video conference, and we will discuss the issue of borders and the need to take measures always aimed at protecting the health of citizens. The Prime Minister has stressed this, and we will take all necessary measures at the appropriate time to ensure the health of Spanish citizens, but also of all European citizens. Jordi Merteran, this is from RAC1. Germany is closing part of the borders. Torra has asked for it. What do you think? Well, from a health point of view, well, Mr. Illa can intervene, but from a security point of view, we have to think that the Schengen area is one of the greatest achievements of the European community. What we talk about is public health, and this is very different. I insist, tomorrow we will take the necessary measures in this regard once the Minister of Health and experts, as well as the Minister of Home Affairs, from a safety and security point of view, are taken into account. We've been working on it together with the Prime Minister, and the Prime Minister is talking about coordinating the efforts, and we will take those measures when and wherever needed, and the measures that we deem necessary. The measures up until now are not static. We are going through a dynamic phase. Every day at 9 a.m. the Prime Minister will meet with us and with experts. I insist, the development of the coronavirus has its own rate, and we are working on what measures can be applied, what measures need to be modified. This is not set in stone. We will review each specific case, and what's essential is that the coronavirus is not spread and that people are healthy. Well, another two questions. Ricardo Rodriguez from COPE. All presidents from the autonomous communities except Torra have signed the report after the video conference. Do you think this is a bad thing? Well, we stand united against this virus, and the only thing I can say is that up until now the work with autonomous communities has been very positive. We've carried out a magnificent task. They've done a fantastic job, and I've expressed my acknowledgement and my thanks not only to healthcare professionals but also to regional ministers of health and their teams. And this is what we're going to do all the time. We will always try and work towards achieving the goal of protecting the health of Spanish citizens. We need to defeat the virus as soon as possible. We all need to follow the recommendations from the experts and the efforts of the healthcare professionals so that we can defeat this virus as fast as possible. And each person will see what's the best thing they can do to join this collective effort. I would like to add something important. As I have said, we held the first meeting of the coordination committee, and obviously the chiefs of the Mossos de Escuadra were there. We gave them the specific guidelines, the action guidelines, as we've done in the past. The state institutions are more than just a few people. The institutions are serious and important, and we're always working towards the health of citizens. We have many questions in terms of mobility for the Minister of Transport. Can you give a few remarks? Well, the government ensures mobility. As I was saying before, we need to balance, on the one hand, not to contribute to contagion of the virus. We need to stop the spread, but at the same time we need to ensure mobility, to access to the workplace, and to go back to the primary places of residence, transport that can supply for materials, and this is what we're trying to ensure. Obviously, we want to stop the spread, so we have to reduce mobility. Mobility is the capacity to propagate. In this regard, we have good measures. We are seeing that the public service is being reduced dramatically in terms of demand. The buses are almost empty. There's been a significant reduction in all modes of transport, and obviously the government will ensure mobility for necessary cases. At this time, the offer is higher than demand. Another question, several citizens are asking about the sanctions, the penalties, if people are carrying out an illicit activity. There's been fake news and unfounded rumors on this. Well, in this regard, the police forces have the legal tools to impose the corresponding penalties. But let's start from solidarity and awareness of citizens. Let's not start from something else. We have proof that citizens are perfectly aware of the importance of our behavior and our conduct towards the virus. I think we have behaviors that will not be solidary, but those are the least. And if we have repeating offences, then the police officers will have the tools to apply. From Argentina, a question: what will be the policy in terms of sanitary health flights that should arrive in Spain to repatriate citizens from other countries? What will be the criteria for those foreigners going back home? Well, we have two issues here. First, the health flights. Those are exempted from restrictions because we are in a state of alarm. We can do health flights, and in terms of repatriation of citizens, there's no problem. This is contributing and collaborating so that citizens from other countries can go back to their places of residence. In terms of the criteria for foreigners who have to do a stopover in a country, there's no issue here. We've only talked about closing incoming flights from Italy, and that's it for now. There's no more reductions, but it's true that other countries are applying this. If this flight is feasible, if it's not closed for incoming flights from Spain, well, at this moment we are discussing international flights, and we will have to discuss this at a European level as well, and there will be consequences. This is the end of the press conference. Thank you very much for all participants.